I'm here at the International Continence Society and IUGA meeting with Dr. Kristene Whitmore. Dr. Whitmore, we're just coming from a seminar where you taught, and you spoke about sexual dysfunction and pelvic pain. What can men and women with IC do to revive their sex lives who do have a lot of pain and avoid sex because of it?
Men and women with pelvic pain have dyspareunia, or painful sex, in up to 80% of cases. So it's very prevalent. And we know that in women with dyspareunia, 50% of them will not have sex because they're afraid to. They avoid it. We know that female and male sexual dysfunctions are very common in this country. They involve desire disorders, arousal disorders, orgasm disorders, and pain disorders. The pain disorders are most bothersome for both men and women. So you have a very prevalent condition. You have four different dysfunctional disorders, and they all overlap. Because if you have pain with sex, you don't have desire because you fear sex. That affects your arousal and your ability to have an orgasm in men and women. And the other thing we need to consider is that partner, because we know that if a man has sexual dysfunction, there's a 40 to 50% chance his female partner will have one or more dysfunction, including depression, and vice versa. If a female has pain, then the male partner also loses desire, which is interest, arousal, orgasm. So that points out that we need to be more sensitive to sexual pain. It's an impact on the other areas of sexuality, and that both partners need to be involved in the diagnosis and treatment of all the pain generators. We also know that once the pain is treated, the sexual functions in both men and women improve. So it's about partners